Right now, you may not know that much about developmental disabilities, so let's start with a brief quiz. Which of the following scenes shows you how you should treat a passenger with a developmental disability? Is it this one? Or this one? How about this one? The correct answer is D, all of the above. In each scene, you saw a driver being friendly and courteous to a passenger and assisting where needed. That is how you should treat all your passengers, including those who have disabilities. Above everything else that you learn in this segment, you must remember that people who have developmental disability should be treated just like you would like to be treated. That means do not treat them with pity, do not look down on them, and never assume that they are not as smart as you. If you are dealing with an adult passenger, never treat that person like a child. Confused? This segment will teach you more about developmental disabilities, what they are, and just as importantly, what they are not. And you will feel much more comfortable in knowing how to deal with your passengers. This segment will explain what a developmental disability is. It will dispel some of the common misconceptions about disabilities and the stereotypes that people form about them. It will show you how different disabilities might affect your passengers and how you should treat them as a result. Finally, it will teach you to deal with the families of your passengers so they will feel comfortable and confident with you as a driver. A developmental disability is a substantial functional limitation that occurs before a person is 22 and is expected to continue indefinitely. It might affect a person's mental or physical functioning, and sometimes both. There are many different kinds of developmental disabilities, such as mental retardation, cerebral palsy, autism, epilepsy, or similar conditions. You will learn to recognize many of these as you gain more experience. Sometimes we also use the word impairments to describe a person's disability. Try not to use other terms that have been used to refer to developmental disabilities or the people who have them, such as handicapped, crippled, retarded, or physically challenged. Many of these terms are either confusing or just plain wrong. Above all, they can be offensive to your passengers. There are many other misconceptions about people with developmental disabilities. You should know and understand the truth before you drive. For example, persons with developmental disabilities are not crazy and they are not dangerous. You have nothing to be afraid of when working with your passengers. Also, persons with developmental disabilities are not entirely dependent upon others for their needs. Although each person's level of ability is different, many persons are actually able to care for themselves completely. Above all else, do not make assumptions about the passenger's mental abilities. Unlike many people believe, persons with developmental disabilities are completely aware of their surroundings, what is happening around them, and what is said to and about them. Many may have a speech or other physical impairment that prevents them from responding, but that in no way means that they do not understand you. This point is especially important because some persons with disabilities have trouble communicating. Many people assume they are stupid or ignorant. Some people treat adult persons with developmental disabilities as if they're children. These are nothing but myths, and they are dangerous ones. Perhaps you have believed some of these myths yourself in the past. The people that you meet on your route will quickly dispel them for you. Although all of them have some type of physical or mental impairment, some more serious than others, they also have much of the same abilities as you. They may want to be friendly with you. They may make you laugh. They may be fun to be with. At the same time, some may give you trouble, and some may not like you, just as anyone else might. The first step is to stop thinking of persons with developmental disabilities as different from others. The second step is to understand just how a developmental disability does affect a passenger. You do not have to know all about the different types, but you should be able to recognize how a person is affected by his or her disability and what assistance that person needs as a result. For now, you should learn to understand and relate to 5 basic types of developmental disabilities. They are mobility impairments, visual impairments, speech impairments, hearing impairments, and mental or cognitive impairments. Of course, some passengers will have multiple disabilities in more than one of these categories. You will learn over time to recognize the symptoms of these. Until then, do not make assumptions. You must remember that not all disabilities are the same and they affect people to different degrees. For example, a person with a visual impairment may be completely blind or may only have trouble seeing clearly at times. Or one person with a mobility impairment may use a walker, while another person may require a motorized wheelchair to move about. Mental retardation also affects people very differently and may be particularly hard to measure. The difference in people's abilities will make a difference in how you treat them and in how much assistance they will require from you. You should know a little about the different types of disabilities for this reason. A passenger approaches your van slowly and stops just before getting on. You think he needs assistance, but are not sure exactly what help he needs. How do you know what to do for him? Ask him. That's right, just ask, and he will probably tell you exactly what the problem is. You will learn more about how to communicate well with passengers with developmental disabilities in Part 4 of this training, but it's never too early to know how important it is. There is one last point that you should remember. When you drive passengers with developmental disabilities, you must not only understand and relate to the passengers themselves, but also to their parents and other family members. Just as persons with developmental disabilities are no different from other passengers, neither are their families different. There may be differences in some families, however, of which you should be aware. Parents and family members of persons with disabilities may tend to be overprotective and overly concerned about your passengers' comfort and well-being. For this reason, some families are just as concerned about the people who deal with and serve their family member during the day. You should be sensitive to their feelings. Gain the family's confidence by always dealing professionally with them and your passenger. Speak with them every time you see them. Listen to any advice they give you, and show them the same respect you show your passengers. Earning confidence may take time, but it will make your job much easier.
Well, I've been having problems with it for, I guess, about a year now. And with her cursing and cussing me. And it makes it really, really hard for me, plus it makes it hard for the rest of the people in my van.
Finally, if you have a serious problem with a passenger or his or her family, do not confront or complain to the family. Instead, mention the problem to your supervisor so that you do not hurt your relationship with either the passenger or the family. Let's review what we have learned. First of all, you now know just what a developmental disability is. You understand that persons with developmental disabilities are not crazy or dangerous, and that they are able to do things for themselves. You know now that they are aware of their surroundings and will usually be able to communicate with you, and vice versa. You have also learned many of the different types of disabilities and how these might affect your passengers. You have also learned how you should treat your passengers who have certain disabilities. That is, with courtesy, patience, and respect, and with assistance when necessary. Finally, you have learned to deal with the families of your passengers so they will feel comfortable and confident with you as a driver. If you have had little experience in knowing or working with persons who have developmental disabilities, all of this may seem like an awful lot to learn. Like most of this training, however, the steps you must take are just simple professionalism and common sense. As you gain more experience in your driving, the things that you are learning here may become second nature to you. Continued review and practice, along with the desire to give your passengers the service they deserve, the best service, is all you will need.
what you're supposed to be serving. I mean the word serving because I believe that should be used in that. And we expect for you to be responsible for them. If you don't want to drive, don't take the job.
Driving for senior citizens usually means providing a service for someone who is used to providing that service for themselves. The reason elderly riders use our services vary, from getting out to perform basic activities like shopping, to medical and doctor appointments, or to access group activities such as senior activity centers, adult daycare, or other services.
Most elderly riders do not have a disability, but may have one or more problems which impair their abilities to provide totally for all their needs. The primary thing to remember is that each passenger is a unique individual. They all expect the same thing from you: a safe and courteous ride, and a sense of security.
Always be courteous. Even when you're driving, you don't rush through traffic. You take the safety way out. If it takes you a little longer, drive safely. The deadline is to get the people to the destination.
A confident attitude shows and will go a long way in helping your passengers be confident in your abilities. The best way to develop that attitude is to plan ahead. Get comfortable with your route before you get in the middle of it.
A lot of drivers will get on the bus and they've got their schedule in front of them, but they've never done their homework, and therefore they're not knowing exactly where they're going. It is important to have the confidence to know where you're going and to not have to worry about getting turned around in the middle of your route.
Well, be prepared so that that passenger you have on that bus feels like you know what you're doing. Because it's bad enough that they're having to ride with a stranger in a bus instead of their own car or whatever. So give them peace of mind and let them know, make them believe that you know what you're doing, you know where you're going, the situation is totally under control. They do not have to worry about anything.
Your homework the night before.
Even when you're confident that you know what you're doing and where you're going, keep in mind that others do not see your driving the way you do. What may be normal for you may seem a bit more uncertain from 3 seats back.
They don't drive reckless, but they drive fast. And I done got old, I'm scared of fast riding.
The perception your riders have help form the sense of security they feel. Know, too, that many riders do understand what it's like from your view.
I've had people who tell me, he drive too fast. And I said, how fast was he going? They couldn't tell me. They said, but that's driving too fast. I said, oh, maybe that's your feeling now. You don't know.
It's nice when your passengers do understand a little about your job. But don't forget, they are your clients and the reasons you are here. Your job is to give good, efficient service and respond to their needs.
Most people, you just need to be there for them. You know, they have a lot of problems. So if they're going to radiation treatments, they've got cancer and they've got these problems, you know, these worries of how they're going to be, how the treatments are going to go for them. And it's always nice to know that they've got a driver that is confident to get them there on time. And it's
Independence is another key issue in working with all passengers. Every elderly rider has gone through a transition where they had to give up some independence because of diminishing abilities. Some may be going through such a transition now, and change can be difficult.
I had a light stroke, well, it affected my eyes more, so I went into blindness. My first reaction of going into blindness is you're denial, and you ask, why did it happen to me? And I just really started getting angry. I snapped at other people, and I know that wasn't my nature.
Blindness, hearing loss, effects of stroke, and other factors contribute.
I had a stroke in my leg. And when I get ready to step up sometime, I can get near about to the top, but I can't get up on the step, you know. And if you just catch my arm and hold me while I kind of lean, then I can get up on the van.
You must be very attentive to each passenger because their needs do vary. The best drivers pay attention to determine when to help and when to just be there.
My experience with driving then, I was a very independent lady. And I cook now, and I take care of myself, I dress myself.
The best way to determine whether a rider needs help is to simply ask. Face your client when you ask questions and listen carefully for their answers.
Some of the people have a speech impairment, and of course you want to listen close because you don't want to have to make them repeat what they've said if you can help it, because that's embarrassing to them.
And don't be afraid to ask exactly how much help they need. Making assumptions may make problems.
They will grab you by your hand and pull you to the van. I bumped my head a couple of times. They didn't know they could only talk to me.
But be careful, because some people do not want to be helped, and they're very independent, and they want to keep their independence. But you want to always be ready, because sometimes they need it.
Not me. Sometimes they will come to help me. I say, you know, I can get on myself.
Help is going outside. I don't know. I know to turn right, you turn left. I'm taught to, you know. But now, where am I going? They can tell me, Miss Bruce, come right on in, and you grab a person on the, you know, I grab their arm, I catch them by their arm, and they can lead me. So you make a right into here, or make a left, or either and then sit down, or go to the far end. I know everything you're saying. I know what what direction, and you're leading me to. Then you sit down. I like to strap you in.
Sometimes a passenger may be able to get on and off the van with little assistance, but may need help with the seatbelt or other items. The main thing to remember is to show a courteous and helpful attitude.
I like for them to be nice and kind, you know. If some people gets on the van, they're not able to get on the van by themselves. I'd like for them to help them, you know, get in and get off, and give them a seat. Sometimes they don't know what they're doing. They try to get up, you know, with that belt fastened around, and they can't get up, and they're just working and picking and scuffling with that van with the belt all the time. And I'd like for, you know, the driver to see what they wanted.
Alzheimer's disease or other mental disabilities may affect some of your passengers. They may require a little extra patience and attention on your part. All you need to do is treat them with the same respect you do all your passengers.
Regardless of how badly impaired someone may be, that person is standing there in front of you, and you have to remember this at all times. If they have a helper, you want to make sure you still talk to the person and talk with the helper and with that person next to you.
It takes time to be patient, but patience is the cornerstone of good service. You can believe that your clients will notice and appreciate it.
He's never in a hurry, he's never too slow. And he helps you all he can. He's a young man. And especially we old folk, he helps us the best he can, I do believe.
Underscoring all your actions is your attitude. Your attitude is shown in the face you wear, the tone of your voice when you speak, and the kindness of your touch.
Attitude is reflected also in your willingness to listen and learn. Even if you already have experience, keep an open mind about learning more.
Always room to learn more. A too experienced driver is hard to get along with at times. I tell you why, because he don't want you to tell him nothing.
Driving skills, good equipment, courtesy, and patience are all primary qualities you need to provide an effective transportation service for the older client. But one quality is even more important than all these, and if you don't have it, you will not succeed. That quality is commitment to your passengers and your job.
Be prepared for where you're going and when to be there.
Be aware of the varying needs of your passengers, how they see things, and what they feel.
Be courteous and patient, and show it with your attitude. Basic customer service is noticed and appreciated. Take the time to do it right.
And most of all, you make the commitment when you accept the job. A commitment to your employer, to yourself, and most of all, to your riders. Keep it.
As long as I worked at the railroad, some people, oh, I'm not going to do that, but they're getting paid to do that. If you're getting paid to do that, do it. If you don't want to do it, just like what Ruben said, don't take the job.
The other day, while John was on his morning route, he noticed that Luana, one of his passengers, seemed ill.
Luana, are you feeling okay? She doesn't look so good. I wonder if she's going to be all right. If I wasn't already 15 minutes late for my next pickup, I'd take her back home. Wait a minute. Luana has diabetes. She might be going into shock. I'd better take her back home.
Although he wasn't completely sure what the problem was, John made the right decision. He is running late and will run even later after turning around to return Luana to her home. But being late is always better than allowing a passenger to become seriously ill.
And yet, there are times when a passenger is feeling nauseous or ill because of their medication or some other reason and will not need any medical attention at all. In this situation, the right decision would be to keep on driving and get that person to his or her destination as soon as possible. But how do you know?
This segment will teach you about some common illnesses that you may encounter in your driving. It will teach you to recognize symptoms of these illnesses, and it will prepare you to act if one of your passengers does become ill.
It will also show you the special care you may need to give a passenger who is ill because they may be weak or in pain. You may need to make a decision similar to John someday. You'll be able to make the right call if you take the time to learn and understand more about the different illnesses that your passengers may have.
If your passengers are elderly or have developmental disabilities, they may also have one or more health problems that affect them on a regular basis, called chronic illnesses. They may include kidney disease, respiratory disorders, heart problems, and several others.
For example, some of your passengers may have diabetes or kidney problems. In fact, you may be responsible for transporting people who have lost kidney function, usually due to diabetes, who require treatment on a long-term basis. This treatment, called dialysis, often makes people very weak. People who you dropped off in the morning feeling cheerful and friendly may return in the afternoon as weak and exhausted. As a result, you may have to give them special assistance and show them a little extra care. This is just one example of how a passenger who has an illness might feel.
Respiratory illnesses that affect a person's breathing are also common among your passengers. A person with a respiratory ailment may require fresh air, to be seated near a window, and in rare cases may have an attack while on your vehicle. Watch for signs of an attack and call an ambulance as soon as a problem develops.
Many of your passengers may also have heart problems or high blood pressure. Heart conditions are common among elderly riders or those with Down syndrome.
A heart problem can be extremely serious. You must pay close attention to any passengers who have had a heart condition to watch for signs of a heart attack or seizure.
Take careful note of the symptoms of a heart attack. They include sweating, nausea, ill feeling or appearance, chest discomfort or pain behind the breastbone, spreading to shoulders, arms, neck, jaw, or back, and pressure or tightness.
If you see these symptoms, stop the vehicle immediately and call for help. Lie the person down and make him or her comfortable. Loosen belts, buttons, or any tight clothing, and watch the person closely. If the person is conscious, ask about medication. It is possible that he or she may have some that will ease the attack.
Do whatever you can for the person until an ambulance arrives. You should also know CPR in case a full attack does occur, but recognizing the symptoms and early intervention is the best thing you can do.
Just as you would assist a person who may be having a heart attack, you will take similar steps to prevent and treat any oncoming illnesses.
First, keep an eye on your passengers at all times and recognize the symptoms of a potentially serious illness. Obvious symptoms include unconsciousness, paralysis or inability to move, convulsions, nausea, difficulty breathing, or any extreme pain at all.
But there are also less obvious signs that a passenger is becoming ill, such as sweating profusely, pale or gray skin color, slurred speech, and dizziness or feeling lightheaded.
When you see a passenger becoming ill, do not waste time. Treat it immediately. Stay calm and act quickly and safely.
First, pull over and stop the vehicle immediately. Make sure that you are safely out of traffic.
Second, ask the passenger what's wrong. If he or she is conscious and can speak, they may be able to tell you what the problem is. If not, you must use your best judgment or radio in to your supervisor. Describe any symptoms the person has. Remember, in an emergency, seconds count.
If you think the passenger will require more care than you can provide, radio for an ambulance and do so right away. If you are not sure if an ambulance is needed, it is better to be safe. Make the call.
Finally, treat the passenger as best you can until an ambulance arrives. Try to keep all your passengers calm and reassured.
There is another very serious type of chronic illness that you should know about. It is acquired immune deficiency syndrome, or AIDS. AIDS is caused by a virus that damages a person's immune system.
There are several myths about AIDS and how it is spread. You should know the truth about AIDS. You should also know how to best help passengers of yours who may have AIDS, so that both you and your passengers travel in comfort and safety.
First of all, you should know that AIDS is nothing to be afraid of. It cannot be spread through the air or by touching an infected person. AIDS is spread only through direct contact with the bloodstream. By avoiding contact with any blood or bodily fluids, you will be perfectly safe.
Since the spread of AIDS in America, it has become normal to take regular precautions that will prevent you from obtaining the virus indirectly. By following these very basic safety precautions, there is no way that you can become infected. These precautions include wearing plastic gloves and safely disposing of all materials that do come in contact with blood.
These steps are not merely to prevent AIDS, but to keep you from exposure to any number of infections or viruses, so you should use them at all times in any of the following instances. Whenever you are exposed to a person's blood or other bodily fluids, whether you are giving first aid or simply cleaning up, you are in no danger if you take those precautions.
Before you actually begin driving, you will be given a safety kit that will contain gloves, cloths, and other materials that will help you to provide first aid or clean up blood or other bodily fluids in the safest way possible. You will be trained and tested on the use of this kit, and you must pass this test to become a driver.
You have been told to take these precautions at all times because you can never be sure if a person has AIDS or another infectious illness. There is one more thing to remember. If you do know that a passenger has AIDS, is HIV positive, or has another illness, respect that passenger and that passenger's right to privacy by keeping your knowledge a secret.
All passengers have the right to expect complete confidentiality from you, and the only time you should mention anything about a person's illness is if he or she becomes ill during the trip. Even then, you only relate what happened and nothing more.
Let's review what we learned in this segment. Remember that some of your passengers, including some who are elderly or who have a disability, will have one or more chronic illness, and that these illnesses may put them in serious pain or affect their strength and abilities at any time.
This pain may also affect their mood and their behavior during the trip. If it does, and a passenger begins to act up, you will have to keep things under control, but you should remember, while doing so, that they may be affected by illness.
Finally, you should remember that passengers with any chronic illness, because of the pain or fatigue they might feel, may also require additional help from you in getting on or off the vehicle, in fastening their seat belts, or in just boosting their morale.
And of course you may be asking, aren't I supposed to do this for every passenger? The answer to that is yes. The bottom line is you should be treating all of your passengers with courtesy and respect. You never know what any of them have gone through that day. You never know what pain they might have or how they were treated before they got on the vehicle. They all deserve your patience and your respect.
So when you are asked to understand the special needs of passengers with chronic illnesses and to treat them with kindness, it should be no trouble at all. As a good and prepared driver, you have been doing that all along.
Feel free to stop and rewind this segment or any portion of the tape. Also, you will learn more about chronic illnesses and their safe treatment in your training manual.
This segment shouldn't be hard at all, should it? I've been talking since I was a kid. Anyway, all I'm doing is driving people around, so it's not like I have to be sociable. What could there be here to learn?
If you're thinking these things, well, you're half right. You should not have much to learn here at all. As you have already learned, whether or not your passengers have a disability, or are elderly, or have a serious illness, they should be treated no differently than you would want to be treated yourself. This is true in how you should talk with them as well.
But it is important that you are able to talk to and understand your passengers. And it is important that you actually do talk to your passengers regularly. You may have to ask them questions about their route from time to time.
If there is a problem on the van with one of your passengers, you will be responsible for dealing with it. If you cannot even talk with them, how will you be able to solve any problems that arise?
And in an accident or other emergency, it is critical that you give clear instructions that your passengers can understand easily and act upon quickly.
Finally, and most importantly, you will be spending a great deal of time with your passengers. In some cases, you will be the first person they see each day and perhaps the only person that they see regularly. Being friendly to them and speaking regularly with each passenger will go a long way toward making them feel more comfortable with you at the wheel, and they will enjoy their ride much more.
As a professional driver, you are more than just a way for people to get around. You must communicate with your passengers regularly. The importance of this cannot be stressed enough.
This segment covers a variety of communication skills. It will demonstrate the basic courtesy you must use for all your passengers and everybody else you deal with as a driver.
It will cover the difficulties you may have in communicating with persons with certain disabilities, as well as ways to overcome those difficulties.
This segment will also show you how to use these communication skills to manage your vehicle so that your passengers are comfortable and orderly.
Basic courtesy means making your passengers feel comfortable on your vehicle, being friendly from the moment you greet them to the moment you drop them off, and treating them always with respect.
You treat them with courtesy and respect by not making assumptions about their disability, by talking to them and not down to them. They are your customers, after all, and by allowing them to use their abilities as best they can.
On top of all this, remember to be as friendly as you can be. If you do this, I guarantee that they will treat you with respect as well.
Hey, be careful. Don't you know how to drive?
Usually, anyhow.
Nevertheless, you must treat your passengers better than you would want to be treated yourself.
When you first begin driving, you may have little or no experience in working with persons with disabilities and may still be uncertain how to treat them. As a result, you may be hesitant, even uncomfortable, with talking to your riders who have a disability for fear of offending them. This may also be true with children or elderly or seriously ill riders.
Do not worry. This anxiety is perfectly natural. In fact, you can admit to your passengers that you are not sure how to act or treat them, and in many cases they will understand. Part of this entire training is also meant to help you overcome your anxiety by showing you simple ways to communicate more effectively with each passenger. This includes persons who have particular disabilities that may make talking to them or understanding them more difficult. While, for the most part, all it takes to communicate well with your passengers is to want to, in the case of passengers with certain disabilities, you may have to practice special techniques. For example, persons with a hearing impairment or cognitive disability may have trouble understanding you. Likewise, you may have trouble understanding those with speech or hearing impairments.
Do not confuse different disabilities. For example, by shouting at a person with a speech impairment when they may be able to hear perfectly. Or even worse, by assuming that a person's physical impairment is also a mental impairment. Nevertheless, the following techniques to help you communicate are useful in all situations. In fact, they will help you when you talk with anyone. These techniques are very simple, really nothing more than plain common sense.
First, get the attention of the person before you start talking by calling their name or tapping them on the shoulder. Maintain eye contact with the person while you are speaking. A deaf person may be able to read your lips, and this will help everyone pay closer attention to what you say. If possible, make sure that you are directly in front of a person and always speak slowly and clearly.
There is no need to shout if the person is completely deaf. He or she still won't be able to hear you and will have more difficulty in reading your lips.
Jessica, I have another passenger to pick up, but I will get you to work on time.
Do not speak abnormally slow either. In fact, if you do, a passenger may be less likely to understand you.
Next, use gestures when possible, such as to give simple instructions, like where to sit or to fasten seatbelts. You can also use gestures to greet passengers. Even if they cannot understand your speech, they will know that you are friendly and not ignoring them.
Finally, if none of these techniques are sufficient, consider using gentle physical prompts, such as steering the passenger to a seat. These physical prompts may be necessary if a passenger has a severe mental disability. However, they should be used as a last resort.
And remember at all times, be patient if a passenger cannot understand you. Repeat yourself when necessary, using these techniques whenever possible.
When you have trouble understanding the passenger, once again, be patient. Maintain eye contact and listen carefully, and don't hesitate to ask a rider to repeat himself or herself.
Good morning. My name is Lisa. What is your name?
Chris.
I'm sorry, did you say Chris Peters? Well, it's nice to meet you, Chris. If there's anything you need to say to me while you're on this van, just feel free and just call my name, get my attention, okay?
Do not panic or become frustrated because you cannot understand a passenger. Just calmly ask the person to please repeat himself or herself.
Remember that if you are already able to understand and communicate well with your passengers, then it will be that much easier to cope with any trouble or emergencies that arise.
And problems will arise. While being polite, friendly, and courteous to all your passengers will go a long way to earning the same treatment in return. There will be times when one or more of your passengers will be having a bad day, or be in severe pain, or may take it out on you or another passenger.
Whenever there is trouble, it is your job to take care of it. It is not your job, however, to punish, discipline, or in any way mistreat your riders. It is not your job to yell at them or belittle them in front of others, and it is not your job to teach them a lesson in proper behavior. You simply have to get them to stop disturbing you and the other passengers.
Listen to the advice of other drivers. They have been in this situation before and can tell you what to do.
If the behavior is directed at you, the best thing that you can do is to ignore it, and the person will probably stop soon. Remember not to take it personally. The rider probably just wants attention and is trying to get a rise out of you.
Of course, if a passenger only wants attention, you can give it to them in a way that does not encourage them to keep acting up. When a rider misbehaves on your vehicle, talk to them, but try changing the subject and getting the rider to think about something else. This will satisfy a rider that he or she is being noticed, without having to keep bothering you and the other passengers.
There may come a time when one passenger becomes violent towards you or another passenger. It is especially important that you act quickly at such a time, but it is just as important that you act properly. Know your company's procedure for handling such a situation.
This segment has shown you techniques to be able to communicate effectively with your passengers and to use those skills to manage any problems that may arise during your trip.
Hopefully, it has also shown you how important it is to use those communicating skills and to do so in a respectful, friendly, and courteous manner.
Of course, as with all of your training, you will understand all of this better after you have been out on the road and have experienced it for yourself.
Until then, remember these basic rules to communicate effectively.
First, treat your passengers with courtesy and respect. Talk to them. Just talk to them. They are the reason you are here. Enough said.
Second, remember the techniques to help you communicate more effectively. Maintain eye contact. Speak slowly and clearly. Use gestures. Repeat yourself when necessary and ask your passengers to do the same. When absolutely necessary, use gentle physical prompts to instruct the passenger, and above all, be patient.
Third, remember that you are responsible for managing any problems on your vehicle. And if you are already able to understand and communicate well with your passengers, then it will be that much easier to cope with any trouble or emergencies that arise. Feel free to review this segment or any portion of the tape. Also, you will find more about effective communication and management skills in your training manual.
Morning.
You don't look so good. Were you up late last night?
Uh-huh.
You don't look like you should be driving at all.
And he shouldn't be. Driving when you are too tired is as bad as driving when you are drunk. Both are extremely dangerous.
I really don't feel too well. Do you think you can get somebody to drive my route for me?
All right. I'll do it myself. But you better lie down and get some serious sleep for a while.
This driver made the right decision. All professional drivers have to be alert to do their jobs, but when you are driving other people, it is even more important. Their lives are literally in your hands.
Never forget that your primary goal as a driver and the main focus of this training is to get your passengers to their destination safely. This tape will show you 4 ways by which you will transport your passengers safely.
By being prepared, by getting the most from your training, and by being in good shape to drive every single day.
By paying attention to your driving, being safe and cautious while on the road.
By paying attention to your passengers, assisting them where necessary, and watching that none become sick or injured.
and by simply realizing that you are responsible for what happens to your passengers and taking charge of your vehicle.
That route is my route. Those people are my people. What that means is once I leave the residence, those people become mine.
You are responsible for what happens to your riders, the vehicle, and yourself. You should know how to respond to any situation, whether another car suddenly cuts you off and stops short, whether a passenger becomes ill or needs first aid on your van, or simply whether one passenger is bothering another and distracting you from your driving.
Any of those situations has the potential to put you and your passengers in danger. But they can just as easily be handled by you if you are ready and know what you're doing.
Keep an eye on the road, the other drivers, but still, keep an eye on the people in the van.
Just do the best job you know how to do. Concentrate on the road, but stay aware of what's going on around you too.
You never know what's going to happen on your route any given day, but you can make the best of any given situation by being prepared.
This means getting the most from your training and taking it seriously so you know how to handle any situation that arises. Know your company's policies and procedures for driving safely and protecting passengers.
You also must be prepared every day on the job. Get a good night's sleep so that you are aware and alert at all times. Stop if you are getting tired.
And check your vehicle before every trip to ensure it is in top working condition. The second point to remember is to pay attention to your driving. Concentrate on the road. Move your eyes while driving, regularly checking the road, the other vehicles, and your passengers. Avoid listening to loud music or anything that may distract you and bother your passengers.
Also, be safe and cautious in your driving. You should always drive carefully, but even more so when you are carrying passengers. Do not take chances, strictly obey all traffic laws, and do not hurry needlessly. Never speed or cut corners to make up for lost time. It is always better to be late than to risk injury to a passenger.
In bad weather, drive slowly and with extra caution, even just a light rain.
Third, always pay close attention to your passengers, from the moment you greet them until the moment you say goodbye. When your passengers get in and out of the vehicle, stand by and offer assistance. It is far better to prevent a fall than to treat passengers who are hurt because you were not there to help them.
When giving assistance, be gentle with your passengers. Do not rush them or move them along forcefully. Remind all passengers to fasten their seatbelts. Again, offer assistance to those who may not be able to do it themselves.
And if your passengers use a wheelchair, make sure that the chair is tied down firmly and securely. Recheck it whenever possible.
If you don't tie them down right, swing a corner and they'll swing right out of that chair.
Of course, paying attention to your passengers is just as important during the trip. Keep an eye on them as you keep an eye on your driving.
If a passenger starts to become ill, you will notice it in time to treat it quickly or call for an ambulance. If a passenger starts to bother or hurt another passenger, you will also be able to stop it before it gets out of hand.
Finally, talk to your passengers regularly during the trip. Aside from helping you to stay aware of what is happening in your vehicle, talking with your passengers is simply something you should always do.
The last and most important point to remember is that you are in charge, and therefore you are responsible for your passengers' safety. Remember that you are a professional, and professionals give their jobs their full attention every single day.
And never forget, the single most important thing you must do is get your passengers safely to their destination.
Let's review. What are the basic things you can do to be sure that your passengers have a safe trip?
Be prepared, starting right now. Take your training seriously, whether you are doing it on your own or with a company trainer, and even after you get on the road. Remember, learning never stops.
A too experienced driver, he don't want you to tell him nothing, but there's always room to learn more.
Be prepared for each trip as well. Check out your van before you leave, and make sure that you are fit to drive as well.
Be alert. Get a good night's sleep and only drive if you are well rested. Stay alert on the road by moving your eyes constantly from the road ahead to your rear view and side mirrors to the passengers in your vehicle.
Pay attention to your driving and be careful. Do not speed or drive recklessly. Avoid sudden stops and starts. Take your time, especially in bad weather. Minimize distractions, such as listening to loud music on the radio. And do not ever listen to a portable radio that uses headphones while you are driving.
Always pay attention to your passengers. They are the reason you are here. Offer your help at all times, especially in getting on and off the vehicle or with fastening safety belts.
Keep an eye on your passengers and talk to them during the trip as well. You should immediately notice if one becomes ill or tries to bother or injure another passenger. You should immediately respond as well.
Finally, remember that you are a professional. Professionals give their jobs their full attention, which you must do as well every time you get behind the wheel.
As a professional, you should take responsibility for what happens during your trip. To yourself, to your vehicle, and to your passengers. Be a professional. Take charge.
Feel free to review this segment or any portion of the tape. Also, you'll find more about passenger safety in your training manual.
How much do you know about first aid?
I know plenty about first aid. What's to know?
Do you know how to give CPR?
Well, not CPR, but
Uh-huh. Do you know how to perform the Heimlich maneuver?
The what lick?
Okay. Do you know how to give someone rescue breathing?
You mean mouth to mouth? Sure, I know.
So you could handle that in an emergency.
no, not really.
Do you know what to do if someone has fallen?
I'm afraid not.
What about a severe burn?
Well, not really.
How about putting on a Band-Aid?
Oh, that I can do.
As you watch these scenes, you may remember how to treat some of these situations. But you should know what to do in any first aid emergency, because any of the ones shown here could easily happen on your vehicle. Of course, all of them are easily treatable.
But only if someone present knows what to do and acts quickly. Left untreated, some of these emergencies can be fatal.
The focus of this tape is to show you how to avoid getting into a first aid emergency and how to act when one does occur. There are 3 main steps for each of these.
There is too much to know about first aid to be covered in a brief video, and it is too important for you not to learn it thoroughly. After you watch this tape and study your training manual, you should also sign up for additional training from a licensed and recognized first aid training program, such as from the Red Cross.
As in all situations, it is easier to stay out of danger than to get out of it once you're in. There are 3 things that will help you avoid a first aid emergency.
Be prepared. Know how to act in an emergency. Take basic safety measures before you leave on a trip.
Be careful, especially when you are on the road. Motor vehicle accidents are by far the leading cause of accidental death and injury in this country. In fact, by the time you finish watching this segment, 2 more people will die in an automobile accident.
Finally, be mindful of your passengers. Notice if they seem ill or are acting up. Virtually an accident waiting to happen.
The first step is to be prepared.
You will have to complete a safety inspection every day. A vitally important part of this inspection is checking the first aid kit. If you do not have one in your vehicle, get one and make sure that it has all the necessary components.
Before you leave on a trip, you also must make sure that your radio is working properly. In any serious emergency, you will need it to call for an ambulance or for advice from your supervisor.
These 2 checks will greatly help you be prepared for an emergency. Of course, the most important thing for you to prepare is yourself.
The second point to consider is to be careful. Defensive driving and other tips for avoiding accidents are covered later in this series, but it cannot be stressed enough. You are responsible for your passengers' safety while they are in your vehicle.
But being careful is not limited to your driving. It also means making sure that your passengers avoid the second leading cause of an injury as well. That is, an accidental fall.
Falls are likely to happen when passengers get on and off your vehicle, especially those who are elderly, have a chronic illness that makes them weak, or have any mobility impairment. Not only are these riders more likely to fall, they are also more likely to break a bone or become seriously injured as a result.
To assure their safety, offer help continuously and guide them in and out of the vehicle slowly and gently. Do not grab hold of passengers forcefully, but let them move at their own speed. Of course, that is just one way in which you will keep an eye on your passengers, which brings us to our third recommendation. Be mindful of your passengers at all times.
You have learned that your passengers may have a variety of disabilities or illnesses that may affect them during their trip. They may be able to warn you when they feel a problem coming on, but you must also be on the lookout for symptoms.
Also look out to see that none of your passengers misbehave, hurt another rider, or get up and move about. These actions put your passengers at risk of injury and also may distract you from your driving.
Remember, be prepared for an accident or emergency. Be careful that you do not cause one yourself, and be mindful of your passengers so you can take action even before an emergency occurs. If you have never found yourself in an emergency situation, you may be too shocked or afraid to act. As a driver, however, you are responsible for the safety of your passengers, and so you will be the one who has to provide first aid.
You may also hesitate because you are afraid to make the situation worse. But if you follow this lesson carefully and complete additional training in a recognized program such as the Red Cross, this will not be a problem. Most states, such as Missouri, have passed Good Samaritan laws so that people may give proper first aid without fear of lawsuits. Like other states, Missouri's law protects people who have been through a recognized training program, unless they have done an act of gross negligence or willful or wanton omission.
This means that the law protects you from liability in the event that you are unable to provide sufficient care or if you overlook a minor detail in giving first aid. So do not be afraid. Just do the best you can.
Once again, this tape is not long enough to cover every situation, but it will outline a procedure that will guide you through just about any emergency. The procedure developed by the Red Cross is known as Check, Call, Care. It means that when you find yourself in an emergency, whether it is an accident or if a passenger becomes ill, you should first check the scene to assess the situation, then call for an ambulance on your radio, and then care for the injured person and other passengers as best you can.
When you check the scene, you will determine what needs to be done first, how serious the injuries are, and whether or not your passengers are in danger. Remember, unless you and your passengers are in danger, for example, in danger of fire or being struck by an oncoming vehicle, do not let them leave the vehicle. Your passengers are almost always safer inside the vehicle and are less likely to be injured more if they do not move.
This is especially true of any passenger who may have suffered a severe injury to the head or neck. In these cases, not only must you not move a person, you should take extra care to make sure that their head and neck are well supported. Any movement at all could be severely dangerous and even life-threatening.
After you have a clear picture of the situation, call for help. This should be done quickly, but it is worth the time to do. Paramedics and other ambulance personnel have special training and equipment that will help in situations where you cannot.
When calling for an ambulance, speak slowly and clearly. Tell them your name, where you are, and be specific. And tell them what the problem is. They may give you instructions on how to treat a person until they arrive. If so, listen carefully.
If you must radio your dispatcher to call an ambulance, you should give the same information. Be familiar with the company procedures in all emergency situations. Above all, stay calm.
Finally, you must care for your passengers as best you can until an ambulance arrives. Treat serious life-threatening injuries first, such as severe bleeding, by applying pressure, hard pressure, to the wound. Stop breathing by clearing a person's airway and giving rescue breathing. Heart attack by administering CPR. Choking by giving the person abdominal thrust until the airway is clear.
And finally, shock. Shock is a condition that usually occurs with sudden illness or injury. Its symptoms include pale, cool, moist skin, rapid breathing or pulse, restlessness or irritability, or changes in consciousness. You should treat shock while you treat any other injuries. Loosen the person's clothing. Lie him or her down with the feet elevated slightly, and cover the person with a coat or blanket.
While you are giving first aid, remember to reassure the injured person and the other passengers that things will be okay soon.
If an aide or another passenger offers help, take it. You may be able to save precious time by having that person call for help, or use him or her to keep other passengers calm. Keep the situation under control until the ambulance arrives.
This tape has shown you the things that you must know to provide very basic first aid to your passengers. First, you should always take the simple steps that will help you to avoid an emergency. Be prepared by making daily preparations and safety checks.
Be careful by assisting your passengers and driving with the greatest of care.
And be mindful of your passengers by watching in case one of them becomes sick or injured.
You have also learned the 3 basic steps to follow if an accident or emergency does occur. These are check, call, and care.
Check the scene immediately to see who is hurt and what needs to be done.
Call for an ambulance right away if needed. Speak clearly and quickly. Give them all the information they need. Who you are, where you are, and what is the problem or injury. They will be able to help you more if they know what the problem is.
Now care for injured passengers as quickly as possible. Always stay calm and keep all your passengers reassured.
Do whatever you can until the ambulance arrives. We did not cover the specific techniques you will need, so you should take the time to learn more.
Hopefully, you have learned enough to maintain control over yourself and your vehicle in an emergency. Hopefully, you will stay calm and know what to do when that emergency arises. And hopefully, you will never have to use it.
But if you do, having the right training could save a life. For this reason, you should always try to learn more, especially about CPR and treatment for other life-threatening emergencies, such as severe bleeding, choking, stopped breathing, and shock. Call the Red Cross or another recognized training program today. Feel free to stop and review this tape again. Also, you will find more about first aid emergencies and how to manage them in your training manual. There is nothing wrong with Joe at all. He is simply having a seizure. It will not hurt Joe, nor those around him, and it will be over in just a few minutes. Joe is one of 2 million Americans who have epilepsy. Another name for epilepsy is seizure disorder.
Something's happening to Joe.
This is just one of many misconceptions that people have about epilepsy and seizures.
Epilepsy is pretty contagious, isn't it?
Epileptics are dangerous. I mean, aren't they crazy?
Well, I don't know much about mental retardation.
It's not a sickness. It's not a sickness. It's a disorder of electrical discharge in the brain that happens.
First, you should know what epilepsy is not. Epilepsy is not a disease. It is not contagious. It is not a form of mental illness. Epilepsy has nothing to do with a person's intelligence or mental capability.
The term epilepsy, it's a term that hits you kind of hard. One, you don't know a lot about it, and it wasn't until we really learned a lot about seizure disorders and epilepsy that you can come to grips and deal with it.
How do you deal with it? You have to hold them down so they won't hurt themselves.
Yeah, stick a spoon in their mouth.
And when it's over, you give them a drink of water to calm them down.
No, not only are these actions unnecessary, in many cases they are actually harmful. The truth is, first aid for a seizure often requires that you do nothing at all. When you do need to act, you simply need to gently protect the person from physical injury during the seizure. You also have to reassure your passengers, including the one having the seizure, that everything is going to be all right.
Some people have the same old the old-fashioned, mad dog running through the street, frothing at the mouth type of concept of epilepsy, which I have yet to see, and I've seen my fair share.
The first thing you should know is that in almost all cases, a seizure will not harm the person having it. It should not last more than a few minutes, and the only harm a person can come to is from the objects and people around them. There are different kinds of seizures, but you should know how to recognize and treat 4 common types.
They are the absence, the simple partial, the complex partial, and the tonic-clonic. In an absence seizure, the person may stare off into space for just a few seconds and lose consciousness.
How was your day at school?
It was pretty good. We have a lot of homework tonight, so that would be.
Zach? Zach?
Yeah, a lot of homework and math and science and a big test.
There is nothing you can do for a person experiencing an absence seizure. In fact, the seizure may be over before you even notice it. If you do notice an absence seizure, let the person know.
Did you just have a seizure?
What do you mean?
Well, you stopped right in the middle of what you were talking about, and you just kind of stared off, and it's like you weren't quite there. Yeah.
Since it happens so quickly, and because he loses consciousness, he may not even realize he had a seizure. If the absence seizure does not end quickly, call an ambulance.
The second type of seizure is the simple partial seizure. There are 2 types of simple partial seizures. A motor seizure, in which a person feels trembling in a single part of her body, such as her arm. Or simple partial sensory seizure, in which the person experiences a strange feeling or sensation, such as an unfamiliar smell. In both these cases, the simple partial seizure will not require any first aid. The passenger will remain conscious and may be able to tell you what's going on.
The other 2 types of seizures are more serious and will require first aid from you.
In a complex partial seizure, a person will seem to lose consciousness, but will not pass out. Instead, she may smack her lips, look aimlessly about the vehicle, or begin moving about.
Ruth, what are you doing? Lloyd, I think she's having a seizure.
Okay, hold on. Let me pull over to the side. She's going to be okay.
As soon as a rider begins to have a seizure, find a safe place to pull over and stop the vehicle. Make sure that you are safely out of the way of traffic.
You're going to be okay.
The complex partial seizure should last from 30 seconds to a few minutes. Spend this time making sure that the person does not get hurt, and reassuring her and other passengers that everything will be all right. Although the person does not seem conscious, she may still be able to hear you.
Don't worry,
So talk to her and reassure her.
It is important not to restrain a person during a seizure, so remove her seatbelt.
You know where you are?
If she tries to get up, however, gently protect her from harm or from moving around the vehicle.
Okay, just sit back and relax.
Finally, there is the tonic-clonic
Everyone calm down.
seizure.
Having a seizure. Let me pull over to the side.
This is a very dramatic type of seizure. The person may first lose consciousness and go rigid, and then may begin to shake. As with other seizures, do not interfere with the person. Let the seizure run its course. If you can, gently lay the person down on his side and place something soft under his head. Remove any restraints, such as seatbelts or anything that might cause harm, such as the person's glasses.
Do not attempt to restrain the person, and never put anything in his mouth. People once thought he could swallow his tongue, but this is not true. Finally, continue to reassure the person and the others in your vehicle that he is going to be all right, that he is just having a seizure and it will be over soon.
Are you all right?
Yeah, I'm okay.
You know where you are?
I'm in the care cab.
You're gonna be okay.
Okay.
He's gonna be okay in a few minutes. Just relax.
Good. Just need to rest.
A person may feel confused, disoriented, or embarrassed after having a seizure. He may have lost control of his bowels or other bodily functions. Be prepared to handle the situation sensitively.
Although a seizure usually runs its course without doing any harm, there are some cases in which a passenger may be in danger. In the following situations, don't waste time. Call an ambulance if a person has never had a seizure before, if the seizure lasts more than 5 minutes, or if the person goes right into another seizure.
Call an ambulance if the person does not regain consciousness after the seizure is over, or if the person appears injured. You should also call an ambulance if the person is pregnant or if the person is diabetic.
Being able to handle seizures comes down to two things. First, you must understand epilepsy, so you can recognize a seizure and know how to act. Second, as always, you must act calmly and with common sense. This way you are sure to do the right thing, and also keep your passengers calm and reassured.
And don't get scared, and that's, just try and stay calm, because it is scary to see, and it took me a long time to realize he'll be okay, he's going to come out of this, and he always has.
Some of your passengers, whether they are elderly or have a developmental disability, will have a mobility impairment, a physical disability that affects their ability to move about. Some may even use a wheelchair and may need your assistance in getting on and off the vehicle.
Vans and buses are now equipped with motorized lifts and special places inside to place wheelchairs. These will make your job much easier and the ride for your passengers much more comfortable.
In order to provide safe and comfortable transportation for passengers who use wheelchairs, you must operate this equipment. you must learn to operate a motorized lift. You must also know how to properly and securely tie down a wheelchair once it is in your vehicle.
Just as importantly, you should understand what it's like to use a wheelchair. This will help you to know how you should and should not treat a person with a mobility impairment.
This segment will show you how to operate the lift safely and how to tie down wheelchairs securely inside the vehicle. But first, it will offer suggestions for understanding and communicating better with passengers who use wheelchairs. Remember those 3 points in order to provide a safe and pleasant ride.
It was once thought that persons with a mobility impairment, or any disability, needed constant assistance. Today, we know that is not true.
In fact, some of your passengers who use a wheelchair will prefer to maneuver themselves. In these cases, you must let them, even when you think that you could help them more quickly and easily.
How do you know when to offer assistance and when to just stand back? You only have to ask a rider if he or she would like some help. Follow these suggestions to communicate with a person using a wheelchair.
First, move to where the person can see you. Bend or crouch down if you need to, and look the person in the eye. Do not stare at the person's chair or body. This is nothing more than common courtesy.
Persons with cerebral palsy or a severe mobility impairment may also have difficulty with their speech. When asking a question, listen carefully for an answer, or watch for a nod or other sign. If you cannot understand what a person is saying, do not be afraid to ask the person to repeat himself.
There are also some things that you should not do. These include leaning on or grabbing a person's chair without their permission. People that regularly use a wheelchair often feel that the chair is a part of themselves and would not like it being grabbed any more than you would like being grabbed yourself.
Do not hurry passengers who want to maneuver themselves. If they seem to be having trouble and become frustrated, reassure them and be patient.
Be especially careful with passengers who use a motorized wheelchair. Frequently, the controls of these chairs are programmed to be used only by the person in the chair. Playing with them could damage these controls.
Finally, there are some riders who will gladly accept your assistance in getting on and off the vehicle. In these cases, assist them cheerfully. Be sure to use the greatest of care.
You should now have a better sense of what it is like to use a wheelchair and be able to see things from your passenger's view. This will help you to relate to them better. The rest of this segment covers the specific procedures used to safely transport passengers who use a wheelchair. This includes operating the motorized lift and tying down chairs inside the vehicle.
An essential step in this process is preparation. You must make sure you have all the right equipment and that it is working properly before you leave on your trip. Do you have enough straps to tie the chairs down?
Are the straps in good condition without being frayed?
Most of all, is the lift functioning properly? No matter how much of a hurry you are in, this should always be checked as part of a pre-trip inspection. It does you no good to find out you can't load or transport a rider safely after you arrive to pick her up.
The lift will operate only if 3 things are done first. First, set the parking brake to keep the van from rolling. Next, turn on the vehicle's hazard lights to warn passing traffic that you are loading passengers. Finally, you must turn on the power switch for the lift itself, which is located under the dash.
On most vehicles, the lift will not work unless all 3 of these steps are taken. Since they are important safety precautions, they should be done in all cases. If the lift is working properly, its operation is simple. Open the vehicle's loading doors. If they do not stay open on their own, hold them open with the latch or strap that is provided.
Your lift is equipped with a switch to raise the platform and lower it to the ground. Some lifts also have a second switch to fold and unfold the platform.
If your lift has only one switch, then you must unfold the platform by hand. Grip it firmly in one hand. Otherwise, it might swing loose and fall on top of you. With the other hand, unlatch the platform. Step back as you swing the platform down. In vans with 2 switches, this is done just by pressing a button. Use the other button to raise and lower the platform.
The platform must be completely folded before traveling. For platforms that fold by hand, be sure to fasten the safety latch when stowing it away. When picking up a passenger, ask him whether he wants your help in getting on the platform.
The platform is equipped with a guard to keep the chair from rolling off the edge. Step down on the latch as the passenger wheels on.
Watch to make sure that the person's hands and limbs are inside the platform. After the rider is safely on the lift, be sure to lock the wheels of the chair so that it does not move.
Raise the lift until it is level with the floor of the vehicle. Then instruct your passenger to back into the vehicle. Offer and provide assistance where necessary.
The procedure for dropping off passengers is the same. Guide the passenger onto the platform carefully. Lock the wheels of the chair and watch the person's arms and legs while lowering the platform. Finally, hold down the platform guard for the chair to cross.
You now know how to help a passenger on and off of the vehicle. In order to keep that passenger safe during the ride, however, you must know how to fasten the chair down during the ride itself.
Your vehicle is equipped with straps known as tie-downs that will do just that. For most chairs, you will need 4 tie-downs, 1 for each corner of the chair. Become familiar with the different types of tie-downs so that you know how to use each one. Then use the following steps to fasten a chair in place.
First, always face the rider toward the front of the vehicle. This is the safest position.
Second, attach the straps to the floor of the vehicle. There will be several slots available to place the straps in. Use the slots that allow for the least movement. These should lie just outside the wheels of the chair.
After you have been driving a particular route for a while, you will become familiar with the best places to fasten down each individual wheelchair. This will eventually save you both time and effort.
Next, it is time to fasten the tie-downs to the chair itself. There is no standard way to do this. There are over 100 different types of wheelchairs, and each one may require a different way of attaching the tie-downs. Always fasten the strap to a sturdy part of the chair that will not break or bend under force. Remember, these chairs will feel a lot of pressure from all sides while you are driving.
Also, attach the strap to a part of the chair where it will not slide or move. A point just above where 2 bars come together is a good spot.
Finally, try to fasten the strap as high up on the chair as you can, as long as it is a sturdy part where the strap will not move. The higher that you fasten the strap, the less likely it is to tip over during the trip.
After you have attached the tie-down to the chair, pull as hard as you can on the strap. This will remove any slack and tighten the chair down more.
Always begin in the back of the chair. After the back 2 straps are fastened with no side-to-side motion, then you may move to the front. Once again, be careful to attach the strap to the chair in a secure spot.
Finally, and with no exceptions, make sure that the person is securely fastened into his or her wheelchair. You are not allowed to transport a rider in a wheelchair without his or her own safety strap, and it will do no good to have a secured chair if the rider cannot stay in it.
You now know how to safely transport a passenger in a wheelchair. You have learned how to operate the lift and how to securely tie down a chair. You have learned how to properly inspect this equipment before you leave on a trip.
Most of all, you have learned to respect the abilities of passengers with mobility impairments and to be patient if they wish to maneuver themselves. You know to always offer assistance, but never force it on passengers. This is simply how professional drivers act. Feel free to review this segment or any portion of the tape. Also, you will learn more about transporting passengers with mobility impairments in your training manual.
The key element in vehicle safety and reliability lies in preparing ahead. And yet, drivers often fail to take the simplest of precautions before heading out on the road. They're surprised when the vehicle runs out of gas.
Not many people would order something off a menu until they had some idea what they were getting.
You would never buy a new car without looking it over first.
And yet, when we begin a day in service, we drive off without giving our vehicles even a quick look. This is something you shouldn't do in your own car.
But when you're transporting passengers and their safety is your #1 priority, making sure that you and your vehicle are in perfect shape becomes a necessity. That is why you should make a brief vehicle inspection before every trip. That's right, every trip. It won't take as long as you think, and you need it.
It may take a few days for you to get the hang of it, but in time, you should be able to do a complete inspection on your vehicle in less than 10 minutes.
And that includes a full inspection, inside and out.
Tracy begins her inspection with the inside to make sure that it is clean. While trash may not be a great safety hazard, you should still clean your vehicle every day. People have to ride in it.
Tracy also goes through the same procedure every day. That way, it becomes a natural routine for her, and she's less likely to overlook something. A good way to organize your inspection is to use a printed checklist. Your company probably uses one already.
Let's start with a typical inspection, one that is required of drivers who provide service to elderly persons or to persons with a disability. Start in the driver's seat and check that all your controls, gauges, and accessories are operating properly. Turn on the headlights and pop the hood. Now step outside with your checklist to make sure that the lights are on. Even if a single light does not work, report it immediately.
You do not have to be a mechanic to check under the hood. Know how to pop it from inside the vehicle and how to support it when you are checking underneath. In most vehicles, you will find a folding rod that will hold the hood up. Make sure that the rod is securely in place.
Before you do anything else, check the oil. Recessed into the engine compartment, you will see the handle of the oil dipstick. Pull it out and wipe it clean with a rag. Then insert it again. When you pull it out the second time, you will see the correct oil level. This test must be done with the engine off.
Most days you will not find anything wrong. There will be just enough oil and it will be a clear brown color, but you should always check. Driving with the wrong amount of oil, too little or too much, can damage an engine quickly. Also, burnt, dirty, or discolored oil is an early sign that something else may be wrong with your engine. After checking the oil, get back inside and start the engine. You will need the vehicle to be running to complete the inspection.
Remember to press the idler switch after starting the engine to keep it from overheating. Also, to press the parking brake fully, even though the vehicle is in park.
Quickly check the various dashboard gauges to look for trouble and to make sure they are working. Be sure that you have enough gas, enough oil pressure, and that your engine is not running too hot.
How about the heater or air conditioner? By now, it should be able to blow warm or cold. Do not forget to check the fan that blows air to the rear of the vehicle. Your passengers have to be comfortable too.
Also, check your windshield wipers and washers. Make sure that you have enough washer fluid and that the wipers work cleanly.
Now check the turn signals. Check front and back flashers on both left and right sides. Also, check your hazard lights. They might not work even if your turn signals do, so get out and look. Leave the flashers on so that you can check the lift.
If you're transporting any passengers who have a wheelchair or have another mobility impairment, then you know you have to check the lift. If you're not sure, then do it anyway. As with every part of the inspection, it won't take long, and you really are better safe than sorry.
Earlier in your inspection, you started the engine, set the idler switch and parking brake, and turned on the hazard lights. In most vehicles, these steps are required for the lift to work, so if you miss them, go back now. After securing the lift doors, simply lower the platform all the way to the ground and raise it up again using the lift controls.
If the lift still does not work, it may have shorted out. You may wish to report the problem to your company, but you might be able to fix it yourself. Look under the hood again. Be careful as the engine is now running. Punch the red button you see a few times. This will reset the lift circuit. If the lift still does not work and you have performed all these steps, then report it to the garage.
You have checked the turn signals, heater, air conditioner, lift, and gauges with the engine running. Listen as you go through these steps to make sure that the engine is running smoothly. If you hear any roughness, hammering, or other strange noises, report it to the garage as well.
You may now climb back into the driver's seat and shut off the engine, but there are still a few items left to inspect. Tap the horn to make sure it works. You never know when you may need it.
Make sure that your radio works. You will need this every day.
This is $298.
Now walk around the van one last time. Look for any damage and report it before you leave.
Check the tires. They should be inflated properly with just a slight bulge at the bottom. You should also check to make sure that the threads are not worn too thin or that they are worn unevenly, a sign that something is wrong with the vehicle.
Finally, give a quick glance underneath the vehicle to make sure that nothing is dragging or broken and that nothing is leaking, such as gas, oil, or engine coolant.
There are a few other things that you should check before you leave on your trip.
Make sure that your side and rear view mirrors are adjusted properly.
Make sure that you have all your safety equipment, including the first aid kit, a properly charged fire extinguisher, and rope flares or reflective triangles in case of a breakdown.
Also, if you will be transporting passengers who use wheelchairs, count the number of straps and available space you have to make sure it will be enough. Make sure that the straps are in good condition and not worn through.
Finally, make sure that your windows are clean, your seat belt is working, and you will be ready to go. Would you like to see that again? See, it doesn't take that long at all.
Remember, eventually something will break down in your vehicle. If you notice it before you get on the road, you'll end up saving yourself a lot of time.
And headaches.
A thorough inspection is required every day. More importantly, it will be well worth the time spent for you, your company, and your passengers.
As you gain experience, you will see that it does not take long to complete. A lot less time than sitting on the side of the highway. Feel free to review this segment or any portion of this tape. Also, you will find more about vehicle safety, including an inspection checklist, in your training manual.
You may have seen this action before, but it's a very different stunt when it's done while driving a bus or a van. You will have the same problems every time you make a turn, if you aren't careful. Can a 25-passenger bus stop on a dime? Well, maybe. But at a normal speed of 35 miles per hour, it would have to start to brake 250 feet away, and that's without passengers. Even then, there's no guarantee. What these examples are telling you is that vans and buses are a great deal more difficult to handle than the passenger car you might be used to driving. Learning how to handle the buses or vans you will drive is one of the toughest parts of this training. You will not learn this completely until you have gained some real experience behind the wheel of the vehicle. But this segment of the tape will cover a number of situations that you are likely to encounter so that you are prepared to react when they do occur. These situations include driving in bad weather, driving through crowded traffic, and most of all, defensive driving, looking out for the bad driving of others. With a little practice and caution, you will soon know how to handle yourself and your vehicle. But you still must know how to act when a driver around you doesn't. As a professional driver, you will often have to make up for the mistakes of others on the road. Most of the things that cause problems, and sometimes accidents, are just tiny mistakes that drivers make. But they can cause big problems if you are not ready. As you can see, your vehicle is difficult to control. In bad weather, on icy or slippery roads, that is doubly so. Avoid any situation where you might have to brake suddenly when you have passengers. A sudden stop can cause you to lose control of the van, especially in bad weather. Even if you maintain control, you may still injure one of your riders. Remember that many have physical illness or disabilities that cause them greater pain than others. So that you never have to stop suddenly, always leave plenty of room between you and the vehicle in front of you. And do not speed. Be especially careful when maneuvering the vehicle. One of the things you will definitely have to become familiar with is the blind spots. Any car has blind spots, but on a care cab vehicle, they are especially dangerous because they are that much bigger. When you're on the road, not knowing when a car is in your blind spot, you're asking for an accident. With a little practice and caution, you will know how to handle yourself and your vehicle. You next need to know how to act when a driver around you doesn't. As a professional driver, you often have to make up for the mistakes of others on the road. Most of the things that will cause problems, and sometimes accidents, are just tiny mistakes, but they can cause big problems if you're not ready. Here are some of the situations you will have to deal with. What is the first thing most people will do when they come up behind a bus or a truck? That's right, you want to get away from it. So when you're actually driving the bus, you should be ready for this to happen at any time. If it does, let them go. Always leave enough distance between you and the car in front of you to allow yourself to stop if you have to. Remember, they will treat you as if you can stop on a dime, but you already know the answer to that. Another one of your biggest pressures is running on schedule. As you become familiar with a route, you will learn to allow yourself enough time for the unexpected. Even still, there will be situations that you just can't prepare for. When these events happen, remember, the safety of your passengers is your #1 priority. You may be tempted to make up time later in your trip, but don't. Better late than never, the saying goes. As we told you before, the best thing you can do in any situation is prepare ahead. In these cases, you can't know what's coming, but you can make sure you are fully capable of handling the vans and buses. And you must be sure that you are completely alert and fit to drive every day. This means that you aren't working on just a few hours sleep, so that your reaction time is slowed. It means that you are not terribly sick, so that you can't concentrate on the road and your passengers. And in absolutely no cases at all does it mean that you're under the effects of alcohol or drugs. There is no way that we can tolerate putting you and your passengers in danger for such a stupid reason. There is one more thing to be said. All of these situations we've discussed here will only be more difficult in bad weather. Rain, fog, and snow will decrease your ability to see ahead of you, giving you less time to react to a situation. Because the ground will be slippery, you will have even less control over your vehicle. It will be even harder to go around turns, and will take much longer to stop. And because these conditions affect everyone on the road, you have to be that much more careful of the cars around you. Remember, they are not professional drivers, and they will not be able to handle bad driving conditions as well as you. If the weather gets too bad, pull off the road and stop. If you cannot drive safely, don't go. If it's not as bad as that, the next best thing you can do is slow down. Let the dispatcher know the trouble you're having, then don't worry about the schedule. Before you are out on the road, you must be able to safely guide your vehicle through traffic. You also will have to back it into parking spaces or parallel park at the curb, and you will have to know the limits of what it can do. You will learn the key maneuvers, such as backing in, parallel parking, and hand-over-hand steering. Just one hint, this isn't it. Have you learned everything so far? No, you bet you haven't, because the things you saw in this tape are only the beginning. But you have plenty of time. If you have paid attention to this video and study your workbook, then when you are out on the road, you will find that these techniques come easily. Soon you will be doing them all naturally, as if you had known the proper behavior all along. Good luck.